Well, this is a very difficult situation because a 14-year-old boy who is wetting pretty well every night obviously has a fairly major problem. The major difficulties that are associated with a 14-year-old, or actually all anoretic children, is a failure of development of three body functions. That is, they have a very infantile bladder that contracts on its own when it gets filled, that they have a problem of very deep sleep and do not arouse the fact that their bladder is getting big, and thirdly, they are producing too much urine overnight. This 14-year-old boy obviously has all of these problems in fairly major concern. The likelihood of this child receiving instantaneous cure in a short period of time is not high. It may be a very slow and prolonged process. However, there are two techniques that might be used. One is alarm therapy, and the second is medication, DDAVP melt. I would prefer the second to the first because if this child does not wake up at age 14 to the fact that he is wet, perhaps the alarms may not be helpful. I think that it's very important that the family doctor appreciate that even though a child may outgrow this, it has a major impact upon the child's self-esteem. And if the child is quite concerned about the problem, then I think the parent must relay that information to the family doctor. My child has concerns, they would like this to have some element of improvement, what would you suggest? At age 8, again, the alarm therapy might be helpful as long as we have a committed family, or DDAVP melt, which is the medication, might improve the situation. Now, I mention the word improve rather than cure because not all children will necessarily respond rapidly to this medication. Well, I guess it's just you being a bit hopeful. I don't like using the term diaper because they really are not diapers, they're training pants. But remember, when that training pant gets wet, that's right against her skin. And so if anything is going to cause her to wake up, it would be being in one of these training pants. So the fact that you take it off does not change the situation in any way whatsoever. But again, at age 6, this is a very, very common problem. Somewhere in the neighborhood of 15% of 6-year-olds are still wetting the bed, and there is a slow improvement rate that might be afforded to this child. So a short discussion with your family doctor could still be in order. A very frustrating situation because I think your child has got a major sleep disorder. One is sleepwalking, and the second is a sleep arousal difficulty. Most people, if you nudge them or push them, they'll wake up. But obviously your child can get out of bed, wander around the room, and still not wake up. He has all of the characteristics of a bedwetting child. That is sleep, deep sleep. Number 2, a full bladder. And number 3, a bladder that empties on its own. What he is seeking during the night is trying to get to the bathroom. Obviously can't find it, He may be dreaming that that's where he is, and so he's voiding. Again, we could try to use the alarm in a child like this. It might be helpful, and perhaps the alarm will stop him from getting out of bed and walking around the room. Or you could try the other medication, DDAVP melt. Again, a very difficult problem, because one of the difficulties with kitties who wet the bed is a major difficulty in arousal. And this will persist for several years. But you have to appreciate that at age 4, somewhere in the neighborhood of 20% of children are still wetting the bed. So you've got a lot of company. I know company is not necessarily going to comfort you, but there are a lot of children who out there are doing the same sort of thing. If you can get her out of bed at the time that you are going to bed, if she hasn't already wet, get her into the bathroom, see if you can get her bladder emptied, and see whether this will be of some value throughout the rest of the night. But patience is probably a virtue in this instance, because at age 4, there's a large number of children who are still wetting their bed. Well, your son is going to grow out of this, but I don't know how soon. The fact that he did have a period of being dry and now is wetting again is not unusual. About 10 to 15% of bedwetting children go through a pattern like this. And the reason is that their sleep patterns have changed from being relatively arousable when they were younger to being relatively unarousable as they grow older. I think you will probably find that he is a difficult child to awaken during the night. And this is primarily one of the sleep disorders that are associated with bedwetting. So yes, one day he probably will grow out of it. And number 2, no, he is not unusual. Is there an easy solution to this? Again, you can try waking him up before you go to bed at night. I don't think the alarms would be overly effective in a child this young, but the DDAVP melt might reduce the amount of urine that he produces overnight, and his underjams or the pull-ups might contain all the urine that he is producing. Very, very important point. I'm sure that he is very appreciative of the fact that none of his friends are wearing not night diapers, but pull-ups or training pants. Yes, it is a very difficult situation for these kiddies, and that's why their behavior is often so difficult at home. When they're at school and among their peers, they try to fit in as best they possibly can. When they come home, their true feelings probably begin to show. This has a major impact upon children and their value and self-esteem, the way in which they interrelate with other peers, their fear of being found out, the embarrassment about what's going on. So yes, they'll be very different at home than they are outside. They're concerned about going to sleepovers or camp, or even traveling out of the city, so that it's a difficult thing for these children to have to bear. Wearing training pants at night is not necessarily a big stigma for children, as long as the family is very, very supportive. But again, you can speak to your family doctor and ask for some treatment programs that have been recommended, and at age 8, many of them will begin to be effective. This is probably the biggest difficulty that these children have, being away from home for a period of time and being among a peer group that might find out about their problem. Very, very difficult. I think that you place a child in a great deal of jeopardy by trying to push them into situations which are physically difficult for them to deal with. I wouldn't necessarily push a child to go to a sleepover camp or to go over to a friend's house for a sleepover if there is a major concern about them being wet. Now, many of the kiddies that I see, the people who ask them to go on a sleepover are fully aware of the fact that this kiddie has their nighttime problem. The parents are aware and the child is aware. And under those circumstances, then you can entertain the fact that they can go and visit other children. However, if the child does not know, or going into an area like a camp situation where there are all kinds of children with varying degrees of tolerance, I think that would be a difficult thing for a child to do. So yes, you're correct. He doesn't want to go to camp because he's worried that the kids are going to find out. The medication that is presently on the market for bedwetting is extremely safe. It is a product which almost is exactly the same product that the body fails to make for these bedwetting kitties. This compound is made in the brain in a gland called the pituitary gland, and it tends to concentrate urine overnight. The medication is almost the exact same replica. You give it to the child in the hope that the child will now begin to concentrate their urine, produce less volume, therefore less likely to expand their bladder and less likely for the bladder to contract. So the medication is safe. Not only is it safe by itself, but it's safe when used in conjunction with other medications that the child may have to take. Almost never. There's a lot of mythology about what causes the bedwetting problem. Is it psychological? And the answer is absolutely not. There has not been one study that has ever shown in any element of statistical sort of necessity that any of these psychological problems make a child wet their bed. If anything, it's the other way around. The bedwetting problem will cause the child to have some behavior problems, some acting out, some problems with school performance, or problems relating to his peer group. But the converse is not true at all. So the person to seek is the family doctor, not the psychologist or the psychiatrist.